We have our Reform Eye Cream. This is our opus. We spent 5 years developing this eye cream. And if you've been in skincare for as long as I have and you've worked with other brands, you'll know brands will have like 50 different eye creams. They're like, this one's for fine lines, this one's for puffiness, this one's for dark circles, and you're like, I have all the things. So I need to buy all the eye creams, and how do I put them on? And now I'm in my bathroom for 45 minutes, right? So we at Noon were like, we want one eye cream to do everything. And so that's what we've done with our Reform. So we have a caffeine complex in there that's going to help stimulate circulation and help decrease dark circles under the eyes because of, cooling and things like that. But my favorite ingredient in here is a particular peptide in here called DDBD. It's a dipeptide. It's the same dipeptide that they find in viper venom. So don't worry, we don't have like a creepy snake farm or anything like that. But we synthetically, if we did, I would quit immediately. I'm terrified of snakes. But what we do is we synthetically create that singular peptide, because what we know that viper venom does is it paralyzes the muscle, right? If somebody gets a snake bite, pretty much that muscle is completely paralyzed. And we were like, that's pretty good around the eye area, right? So we figured out that one peptide that does it. So my favorite patient to show the Reform Eye Cream to is my Botox patients. I'm not gonna ask who has Botox in here because that's rude, but I will share that I have Botox. And when you have Botox, you go to bed one night and it's there, you wake up the next day and it's gone. It's not a very gradual thing when Botox falls out. It's like all of a sudden you're in your car and you're like, I have movement, oh my God, you're like on the phone, get me in. It's a whole thing. I love showing people the Reform Eye Cream if they're a Botox patient, because I'm like, what's nice is it makes it a gradual progression. I've noticed now, since I've been using the Reform Eye Cream for about a year, my Botox, I can probably get 6 months between my Botox appointments. It's awesome, and it's a beautiful eye cream. I now take it all the way up to my forehead. I'm like, right? So I use a little more than you're supposed to, but it does the job. So it's really nice. Like if you wanted to do a Botox promotion with the Reform Eye Cream, these are marketing ideas that you can do for your areas. Then we also have our retinol line. So we have, as we know, retinol is the gold standard for treating age management. As we get older, everything slows down, right? Our skin cell turnover rate slows down, so that's why we want retinol. So we have a 0.3 and a 1% retinol, and the question I get all the time is, what's your delivery system? Because that's always the trick with retinol is when we talked about it earlier, when you use retinol, it's really, really irritating. So most brands have to do some sort of encapsulation program to make it deliver without causing a lot of irritation. Guess what our delivery system is? Derm Shield. Doesn't need to be encapsulated, doesn't get buffered. So it's pure retinol, which means it only has to go through one conversion on the skin. It just goes from retinol to retinaldehyde, which gets right into retinoic acid, delivers right into your skin. Absolutely beautiful product. And then we have it fortified with some oligopeptides. It's just very comfortable. I've put people on the 1% immediately, no side effects. Amazing. And then last but not least, of course, we are going to have on its own vitamin C serum. So our VIT C Serum 11s, the S stands for stable. And I say that because remember what I was saying earlier about L-ascorbic acid being really unstable? We just want to let you know this is a very stable form of vitamin C. We're using 2 different forms of vitamin C. One is called ATIP, ascorbyl tetraisopomatate. Call it ATIP, way easier to say. But ATIP is an oil-soluble form of vitamin C. And it's been shown to last within the cell about 80 times longer than L-ascorbic acid. Okay, so we get that really nice oil solubility from the ATIP. And then its sidekick is called AA2G, ascorbic acid 2 glucoside. But this is a form of L-ascorbic acid, but here's the kicker. It's a slow release. So even though it is a water-soluble form of vitamin C, which we know doesn't stick around as long, it's kind of like a gradual release throughout the day, which is really nice. So they work very well together. Now the question I always get is, you just talked about Restart. Restart has the vitamin C. Who gets what, when, where, why? if I'm dealing with a true age management patient, I'm looking at not just fine lines and wrinkles, but I'm also looking at sun damage, then I want them to be using both Restart and vitamin C 11s. Does that make sense? Okay.